You lie awake at 2 a.m. again, staring at the ceiling, your mind racing through everything you need to do tomorrow. Your back aches, your shoulder feels numb. You shift to your other side, trying to find that comfortable position that will finally let you drift off. You've been tossing and turning for an hour now, and you already know that tomorrow you're going to feel exhausted, foggy, irritable. What you don't know, what nobody has told you, is that the position you're sleeping in right now might be sabotaging your blood sugar control. And I'm not talking about some minor effect. I'm talking about the difference between waking up with a fasting blood sugar of 110 versus 160. The difference between your A1C staying at 7.0 versus creeping up to 8.2. The difference between feeling energetic during the day versus feeling like you're dragging yourself through mud. What if I told you that research published just 4 months ago in the journal Sleep Medicine shows that certain sleep positions can raise your morning blood sugar by as much as 40 to 50 milligrams per deciliter compared to other positions? What if I told you that the way you position your body during those 7 or 8 hours of sleep has a direct, measurable impact on your insulin sensitivity, your cortisol levels, your inflammation markers, and your ability to regulate glucose? And what if I told you that most people with diabetes are sleeping in positions that are actively making their blood sugar control worse, and they have absolutely no idea? I've spent the past 19 years as an endocrinologist and sleep medicine specialist, focusing specifically on the intersection between sleep quality and metabolic health in people with diabetes. I've worked with over 800 patients who came to me with uncontrolled blood sugar despite doing everything right with their diet, their medications, their exercise. And when we looked closely at their sleep, not just how many hours they slept, but how they slept, we found patterns that were stunning in their consistency. Today, I'm going to tell you about 4 specific sleep positions that are harming your blood sugar control. But I'm not going to tell you which 4 positions yet, because if I do, some of you will just switch positions tonight without understanding why, and you might actually make things worse. You need to understand the science first. You need to see what I've seen. You need to hear these stories. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below what position you sleep in most of the night, just like this: stomach sleeper, or right side, or left side, or back, or I move around constantly. That's it. No explanation needed. Because here's what I'm seeing in my practice. There's a massive gap between how people think they sleep and how they actually sleep. And that gap is affecting their blood sugar in ways they don't understand. Your comment isn't just information to me, it's data. Data that helps me understand what you're really dealing with. And when I see patterns in these comments, I make videos addressing exactly those situations. So comment your primary sleep position right now. You might feel like you're the only one struggling with morning blood sugar spikes despite perfect evening numbers, but I promise you, you're not alone. Let me tell you about Richard Kowalski. He was 68 years old when he came to see me 2 years ago, frustrated and exhausted. Richard had been living with type 2 diabetes for 11 years. His A1C had been reasonably well controlled for most of that time, hovering around 6.8 to 7.0%. He took metformin, a long-acting insulin at bedtime, and he was meticulous about his diet. Richard tracked every meal, he walked 5 days a week, he checked his blood sugar 4 times a day. But over the past year, something had changed. His morning fasting blood sugar, which used to be in the 110 to 120 range, was now consistently in the 160 to 180 range. His A1C had climbed to 7.9%. His previous doctor had increased his bedtime insulin dose 3 times, from 20 units to 35 units, but it barely made a dent in those morning numbers. Richard would go to bed with a blood sugar of 130, take his insulin, and wake up 8 hours later with a blood sugar of 175. It made no sense. They checked for the dawn phenomenon, the natural rise in blood sugar that happens in the early morning hours due to hormone release. They had Richard set an alarm and check his blood sugar at 3 a.m. It was 145, so his blood sugar was rising throughout the night, not just in the final hours before waking. They tested for sleep apnea, because untreated sleep apnea can wreak havoc on blood sugar control. Richard did an overnight sleep study, and while he had mild sleep apnea, it wasn't severe enough to fully explain his blood sugar pattern. He got a CPAP machine anyway, and he used it religiously. His morning blood sugars improved slightly, dropping from the 170s to the 160s, but they were still far too high. They added a morning dose of another diabetes medication. Richard's A1C came down to 7.6%, but he started having episodes of low blood sugar in the afternoons, blood sugar dropping into the 60s, making him shaky, sweaty, unable to concentrate. He felt like he was on a roller coaster, and he couldn't figure out why his blood sugar control had deteriorated so much when he hadn't changed anything about his diet or his activity level. When Richard came to my office, I did what I always do with patients who have unexplained changes in blood sugar control. I asked about everything: stress levels, recent illnesses, medication changes, dental problems, foot problems, vision changes. And then I asked about sleep. How many hours are you sleeping? About 7 to 8 hours, Richard said. Do you have trouble falling asleep or staying asleep? Not really, he said. I fall asleep within 20 minutes and usually sleep through the night. Then I asked a question that seemed unrelated to him at the time. What position do you sleep in? Richard looked confused. He said he wasn't sure, probably on his side or his stomach. He moved around a lot during the night. His wife was sitting next to him, and she spoke up. She said Richard slept on his stomach most of the night, had done so for as long as she'd known him, over 40 years. But she'd noticed something else. In the past couple of years, he seemed to sleep more restlessly, shifting positions more often, and he'd developed a habit of sleeping with his right arm tucked under his body. I asked Richard if he'd noticed any changes in his sleep position or sleep quality over the past year or two. He thought about it, and then he said yes. He'd been waking up with shoulder pain and neck stiffness more often. His right arm would sometimes feel numb when he woke up. He'd attributed it to getting older, maybe some arthritis setting in. He'd started sleeping with an extra pillow to try to get more comfortable, but it didn't help much. And then he said something that caught my attention. About 18 months ago, he'd had a minor surgery on his lower back to address some sciatica pain. The surgery had gone well, the sciatica resolved, but afterward he found it uncomfortable to sleep on his back like he used to sometimes. So he shifted to sleeping almost exclusively on his stomach and his right side. I asked him when his morning blood sugars had started climbing. He pulled out his glucose log, checked the dates, and said it was about 14 months ago, just a few months after his back surgery. That timing mattered a lot. I ordered Richard a continuous glucose monitor, one of the newer ones, the kind that tracks blood sugar every 5 minutes for 14 full days. But I also gave him a second assignment, something just as important. I asked him to keep a sleep journal. Every single morning when he woke up, I wanted him to write down what position he was in when he woke up, whether he remembered changing positions during the night, and how he felt when he woke up. Shoulder pain, neck stiffness, arm numbness, anything at all he noticed, no matter how small it seemed. 2 weeks later, Richard came back to my office. He had his CGM data, and he had his sleep journal. And when we put them side by side, there it was. Clear as day, impossible to ignore. On nights when Richard slept primarily on his stomach, his blood sugar would start rising around midnight, and it would continue climbing steadily all the way until he woke up. On nights when he managed to sleep more on his left side, his blood sugar still rose, but much less dramatically. We could see it right there on the graph. Stomach sleeping nights, blood sugar went from 130 at bedtime to 175 by morning. Left side sleeping nights, blood sugar went from 130 at bedtime to 140 by morning. A difference of 35 milligrams per deciliter, just from sleep position alone. Richard was stunned. His wife was stunned. And honestly, even though I had seen this pattern before, I was still impressed with how clear the correlation was. So we made a plan, a real plan, not a medication change, not another insulin adjustment, but a sleep position plan. We were going to retrain Richard's body, not to sleep on his stomach, not to sleep on his right side, but to sleep on his left side, and if he could tolerate it, on his back, with proper support. Before we went any further, I told Richard something important. I told him this was not going to be easy. He had been sleeping on his stomach for decades. His nervous system thought that position was safe, comfortable, normal. Changing it would feel wrong at first, uncomfortable, even stressful. But I also told him something else. His blood sugar numbers were already telling us that what felt normal to his body was no longer healthy for his metabolism, and that meant his body had to learn a new normal. We started with small steps. I gave him a body pillow, a long one that he could hug. I showed him how to place it in front of his chest so that if he tried to roll onto his stomach, the pillow would stop him halfway. I told him to place another pillow behind his back so he couldn't roll backwards easily either. This created a kind of cradle that held him on his left side. I also told him to put a pillow between his knees to keep his hips aligned and reduce lower back strain. I told him not to aim for perfection, not yet. If he spent even the first 2 or 3 hours of the night on his left side, that would already help, because the first half of the night is when most deep sleep happens and when metabolic regulation is strongest. Richard agreed to try, but he was skeptical. He said, "I've been sleeping on my stomach for almost 70 years. I don't think my body is going to cooperate." I told him that was normal and that we would work with his body, not fight against it. That week, he started sleeping on his left side, but every morning he still woke up on his stomach, every single time. But something interesting happened. Even with those first few hours on his left side, his morning blood sugar dropped, not dramatically, but noticeably, from an average of 175 down to around 160. That was enough to motivate him, enough to show him that this wasn't coincidence, that this was real. So he decided to go one step further. Before we go further, I want you to know something. You are not alone in this struggle with sleep and blood sugar. Every single week on this channel, I share research-backed information that can change how you manage your diabetes. Information that often takes years to reach a regular doctor's office. If you have ever felt confused by morning blood sugar spikes that don't make sense, or frustrated because nobody explains the connection between your sleep and your glucose control, this channel was created for you. So take a moment and hit that subscribe button, because you deserve to understand your own health. You deserve information that respects your intelligence and your experience. And I promise you, every video here is made with one goal: helping you live better, not just longer. Now, let me explain what is actually happening in your body when you sleep in certain positions and why it affects your blood sugar so dramatically. Your body is not shut down when you sleep. It is working constantly. Your liver is processing glucose and releasing it into your bloodstream in carefully controlled amounts. Your pancreas is producing insulin to match that release. Your muscles are taking up glucose and storing it as glycogen. Your fat cells are releasing fatty acids. Your brain is using glucose to perform overnight maintenance and memory consolidation. All of this has to be perfectly coordinated, And that coordination depends on proper blood flow, proper nerve signaling, proper hormone balance, and proper drainage of metabolic waste products. When you sleep in certain positions, you interfere with these systems, sometimes in subtle ways, sometimes in dramatic ways, but always in ways that affect your blood sugar control. Let me walk you through the 4 positions that cause the most problems, and I want you to really listen to the why, not just the what. Because once you understand the mechanism, you will never look at sleep the same way again. Position number 1, and this is the worst offender of all, sleeping on your stomach. Especially with your arms tucked under your body or under your pillow. This is exactly the position Richard was sleeping in, and it is shockingly common in people over 60. Here's what happens. First, when you sleep on your stomach, you compress your abdomen, and that means you compress your liver. Your liver is the central command center of blood sugar control. It stores glucose as glycogen, and it releases glucose in carefully controlled amounts throughout the night to keep your blood sugar stable. When you press your body weight onto your liver for 7 or 8 hours, blood flow through the liver is reduced. Studies using imaging and glucose monitoring show that this pressure disrupts the liver's normal glucose regulation. Instead of releasing glucose smoothly and gradually, the liver releases it in bursts. That leads to higher and more erratic morning blood sugar levels. Second, stomach sleeping compresses your stomach and intestines. If you ate dinner at 6 and went to bed at 10, digestion is still happening. When you lie on your stomach, digestion slows down. This causes delayed absorption of nutrients, including glucose. So instead of your blood sugar rising earlier in the evening and settling down, it keeps rising late into the night. Third, stomach sleeping restricts your breathing. Your chest cannot expand fully. You take shallower breaths. Your oxygen level drops slightly. Even if it's not severe enough to be called sleep apnea, it's enough to trigger stress hormones, cortisol, adrenaline, both of which raise blood sugar. This is called hypoxia-induced hyperglycemia, and it is one of the biggest drivers of high morning blood sugar in stomach sleepers. Fourth, when you sleep on your stomach, your head is always turned to one side. That twists your neck for hours. This can compress blood vessels and nerves, including the vagus nerve. The vagus nerve plays a critical role in insulin release and glucose regulation. When its signaling is disrupted, your pancreas becomes less efficient at controlling blood sugar. Fifth, most stomach sleepers tuck their arms under their body. This compresses nerves and blood vessels in the shoulders and arms. Muscles that are poorly supplied with blood cannot absorb glucose efficiently, so more glucose stays in your bloodstream and your blood sugar rises. This is why so many stomach sleepers wake up with numbness, tingling, pain, or stiffness in their neck, shoulders, arms, and hands. It's not a coincidence. Position number 2, sleeping on your right side, especially with your right arm under your head or pillow. This one surprises many people. It seems harmless, but it isn't. First, your liver is on the right side of your body. When you lie on your right side, your liver is on the bottom. Gravity causes blood to pool there, and the weight of your other organs presses down on it. This interferes with normal liver blood flow, which interferes with glucose regulation. Studies show fasting blood sugar is usually 15 to 25 points higher in right-side sleepers compared to left-side sleepers. Second, right-side sleeping affects your gallbladder. Bile flow becomes sluggish, digestion becomes less predictable, inflammation increases, insulin resistance worsens. Third, right-side sleeping with your arm tucked compresses the brachial plexus nerves. This reduces circulation to your arm muscles and reduces glucose uptake by those muscles.
So more glucose stays in your bloodstream and your blood sugar rises. Fourth, right-side sleeping worsens acid reflux. Acid reflux triggers cortisol. Cortisol raises blood sugar. Even silent reflux that you don't feel can still raise glucose overnight. Position number 3, sleeping flat on your back with no support. Back sleeping can be helpful, but only if done correctly. Flat back sleeping causes problems. First, it worsens sleep apnea. Your tongue and soft palate fall backward, your airway narrows, oxygen drops, stress hormones rise, blood sugar rises. Second, blood pools in your legs, especially in people with diabetes who already have circulation issues. Muscles don't absorb glucose efficiently. Third, reflux worsens. Fourth, your lower back arches unnaturally. Spinal nerves are compressed. Metabolic signaling becomes less efficient. Back sleeping is only safe with head elevation, knee support, arm support, and proper spinal alignment. Position number 4, chaotic sleeping. Constant position changing, rolling every 30 to 60 minutes. This is a sign of poor deep sleep. Deep sleep is when insulin sensitivity improves, growth hormone is released, cortisol is lowest, blood sugar stabilizes. If you never reach deep sleep, your metabolism never fully resets overnight. Studies show people who get less than 30 minutes of deep sleep have significantly higher fasting blood sugar and A1C. Every time you move, your nervous system briefly activates. Your heart rate rises, stress hormones rise, blood sugar rises, all night long. I need to pause here because I know some of you are realizing something. You sleep in one of these positions every single night, and now you finally understand why your morning numbers make no sense. So let me ask you, do you wake up with numbness, tingling, pain, or stiffness in your neck, shoulders, arms, or hands? If yes, comment, "Yes, I wake up uncomfortable." Just those words, because you are not alone, and your discomfort is not just aging. It is your body telling you your sleep position is harming your metabolism. Now let me tell you about a different patient, someone who discovered the power of sleep position in an unexpected way. Her name was Linda Chen. She was 72 years old when she came to me. Linda had type 2 diabetes for 8 years. Unlike Richard, her blood sugar control had been improving, not worsening. Her A1C had dropped from 8.1 to 6.9. She was on metformin, she followed her diet carefully, but her sleep was terrible. She woke up 4 or 5 times every night, with lower back pain, with hip pain, with stiffness that forced her to get out of bed and walk around. This had started after her left hip replacement surgery. Before surgery, she always slept on her left side. It was her natural position since childhood. But after surgery, that position felt uncomfortable, so she retrained herself to sleep on her right side and on her back. Her hip healed, she had no daytime pain, but her sleep never recovered. She felt restless, unrested, fragmented, and she noticed something important. On nights she slept poorly, her morning blood sugar was higher, sometimes 140, sometimes 150, even though it was normally around 111 to 125. She assumed it was.
Now, let's talk about what the research actually shows. Not opinions, not theories, published medical science. In 2023, a study in the Journal of Clinical Endocrinology and Metabolism followed 240 adults with type 2 diabetes for 30 nights. They used 2 tools at the same time, a continuous glucose monitor and a sleep position tracker that recorded body position every 30 seconds. What they found was shocking. People who slept on their stomach more than 50% of the night had morning blood sugar 42 milligrams per deciliter higher than people who slept mainly on their left side.
Right-side sleepers were 18 milligrams per deciliter higher than left-side sleepers. People who changed positions more than 15 times per night had 28 milligrams per deciliter higher morning glucose than people who stayed stable in one position. And this was independent of sleep duration, sleep apnea, body weight, or medication use. Sleep position alone changed blood sugar. Then, in 2024, a European study used imaging to measure liver blood flow in different sleep positions. Stomach sleeping reduced liver blood flow by 23%. Right-side sleeping reduced it by 12%. Back sleeping had minimal effect, only if the head was elevated. And reduced liver blood flow meant chaotic glucose release. That means more glucose dumped into your bloodstream overnight, higher fasting sugar in the morning. Then a large meta-analysis in Sleep Medicine Reviews analyzed 12 studies, over 8,000 people. They found left-side sleeping best insulin sensitivity, lowest inflammation, lowest cardiovascular risk. Stomach sleeping worst outcomes. They calculated that switching from stomach to left side could lower A1C by 0.4 to 0.6 points in 6 months. That's massive. That's the difference between 7.6 and 7.0, 7.8 and 7.4. That's medication territory. Then another 2023 study in diabetes care examined the vagus nerve. This nerve controls insulin release, glucose regulation, and parasympathetic balance. They found neck rotation during stomach sleeping compresses the vagus nerve, reduces its activity by up to 35%. One night of stomach sleeping was enough to impair nerve function. Several nights of good positioning restored it, which means sleep position doesn't just affect glucose, it affects the nervous system that controls glucose. Now, I want to ask you something. When was the last time your doctor asked you how you sleep? Not how long, not whether you snore, but what position you sleep in. If the answer is never, comment, "Nobody asked me," because that silence is costing people years of frustration. Now let's talk about the best position. The best sleep position for blood sugar control is left side sleeping with support. Why? Because your liver is on the right side. When you lie on your left, the liver sits above the stomach. Gravity helps blood flow through it. No compression, no pressure. Optimal glucose regulation. Left side sleeping also improves digestion, improves lymphatic drainage, reduces inflammation, reduces acid reflux, improves heart efficiency. It's the most metabolically favorable posture the body can take. If you cannot sleep on your left side, the second best is back sleeping with elevation and support, but it must be done correctly. Head elevated about 30 degrees, pillow under the knees, arms supported so they don't fall backward, neutral spine, proper mattress firmness. Flat back sleeping without support is not helpful. Now let's talk about how to change, because habits built over decades don't disappear overnight. Strategy 1. Gradual transition. If you sleep on your stomach, place a pillow under one side of your chest. Tilt your body slightly. Increase tilt over days. Eventually, you'll be side sleeping naturally. Strategy 2. Body pillow. Hug it. Place it between knees. It stabilizes the body, prevents rolling forward, supports arms, reduces shoulder compression. Strategy 3. Sleep position trainer. A device that vibrates when you roll into the bad position. It retrains the brain in 2 to 4 weeks. Strategy 4. Treat pain. Shoulder pain, hip pain, arthritis? Fix the pain first. You cannot change sleep posture if your body is avoiding discomfort. Now optimize sleep environment. Room temperature 60 to 67 degrees Fahrenheit. darkness, quiet, correct pillow height, proper mattress support. Now I want commitment. Comment, currently stomach sleeper trying left side, or currently right side trying back with elevation, or all over trying to stay left side. Writing it creates accountability.
Now I'm going to give you the exact step-by-step protocol to test this in your own life. Not guesses, not hope, data. Step 1. Establish your baseline. For 1 full week, do not change anything. Sleep the way you normally sleep. Every morning, before eating or drinking anything, check your blood sugar. Write it down. Also write down the position you woke up in, how your body feels, any numbness, any stiffness, any pain. After 7 days, calculate your average fasting blood sugar. That is your baseline. Step 2. Choose your target position. For most people, left side sleeping. If left is not possible, back sleeping with elevation and support. Step 3. Set up your bed. If left, body pillow, pillow between knees, firm pillow under head that keeps neck neutral. If back, head elevated about 30 degrees, pillow under knees, support for arms. Spend 1 night just adjusting pillows, not testing yet, just comfort. Step 4. Commit to 2 full weeks. The first nights will feel strange. Your sleep may feel worse at first. That is normal. Do not judge results before 14 days. Step 5. Track blood sugar every morning. Same time, same method. Write down your waking position. You are collecting evidence. Step 6. Compare averages. Baseline week average versus 2-week intervention average. Even a 10 milligrams per deciliter drop is meaningful. 15 to 20 is powerful. 30 plus is life-changing. Also notice less stiffness, less numbness, more energy, clearer thinking. Step 7. If results improve, continue. If no improvement, are you rolling back to your old position? Do you need stronger pillow support? Are you waking too often? Is pain preventing stability? Fix positioning first. Step 8. After 1 month, evaluate. Fasting glucose trend, overnight glucose curve if you have CGM, energy, appetite, weight stability. Better sleep improves insulin sensitivity everywhere. Now let me tell you what happened with Richard after all this. He had slept on his stomach for almost 70 years. First week, morning sugar dropped from 175 to 160. Second week with position trainer, 145. 1 month, 125 to 135. Insulin dose reduced. 3 months, A1C dropped from 7.9 to 7.1. 6 months, A1C 6.8. But more important, no more shoulder pain, no more arm numbness, better sleep, less snoring, 12 pounds lost without dieting. He told me, I can't believe this wasn't the first thing anyone checked. This is why this channel exists. Doctors manage medication, numbers, prescriptions, but they often miss sleep, position, nervous system, posture, breathing mechanics. These are not small things. They control metabolism. Now I need you to comment 1 of 3. Trying left side if you will start tonight, trying back position if you will try proper back sleeping, or need help if you're unsure what's best for your body. Your comment is your commitment. Your comment also tells others they are not alone. Let me leave you with this. Diabetes is not only managed in the kitchen, it is managed in the bedroom. You don't just control blood sugar with food and pills, you control it with posture, with breathing, with nerve signaling,
with circulation. Sleep position is medicine. Free, powerful, under your control. Tonight, your body will choose between better glucose control or more unnecessary struggle. Now you know how to guide it.